70% of coronavirus patients in the country. The medical center has expanded to 600 beds. And it's important for elderly COVID-infected patients to get some kind of exercise, physical activity while they are fighting the virus infection. With us now is Chana Yael Kook, an occupational therapist from the geriatrics department at Herzog, joining us now from Jerusalem. Chana, thank you so much for being with me. Why do you think it's important that these patients get physical connection and as much as possible are able to exercise and move around?
Hi. So first, I'm an occupational therapist, and besides the physical part where we exercise with them, we make sure to treat them with their, to increase their independency, their well-being, and their ability to participate as much as possible, their meaningful occupations. The patients that come to us, the Corona unit, are basically taken from their previous life. If it could be nursing homes, their houses, their families, their beloved ones, and they are basically put in our unit. They're forced to be separated from their family and be with themselves and the staff. So
it must be very lonely and very scary for these patients when they move. So the work you do, is it help with that?
It is very lonely. The main symptom that the patients suffer from, besides the corona symptoms, is the loneliness. The fact that they're separated from their family, they're missing out the time being with them. They're not young, they're not healthy. 2 or 3 weeks without their family is very meaningful and hard. They miss family events and occasions that they'll never be able to participate.
Yeah. So what is the work that you're doing with them? And tell me the reaction you get. I mean, even from their faces, can you see that they're responding?
Yes, of course we could see. We learn to communicate in different ways. They see my eyes, but I see their whole body. If they're able to talk and their breathing allows them, they could communicate, they could share their pain, they're hurting, and we're there for them. We talk a lot about hope and about the fact that it's temporary and they'll be going back to their previous life, hopefully. And we try to be there for them. We try to be as close as possible. Their family's far away. Sometimes me and my staff, we have to be, instead of their children, instead of their grandchildren, their spouses. We try to be as close as possible, touching, hugging, being there for them, listening as much as possible, and thinking of their quality of life and well-being more than anything.
What kind of stories are they telling you? I mean, your job a lot of the times is to listen. What kinds of questions or stories are you hearing from your patients?
Some are very hard. I don't know if I should share in TV, like losing family members, friends. A patient had a friend that just passed away at night, and those are the hard stories.
Yeah.
There's patients that talk about the fact that they don't know if they'll ever be seeing their family. They're missing their schedule. They don't know how life is going to look after leaving, after releasing. Even if the corona, when they're done with the corona, they don't know what symptoms it's going to leave with them, how it's going to affect their dependency. People do not want to be dependent on their surroundings, never. And they know that sometimes diseases happen and they're scared.
Yeah.
They're scared.
Thank you so much, though, Chana, for the work that you are doing and the job that you've undertaken. We wish you success and health. And thank you so much for being with us today from Herzog.
My pleasure. My pleasure.